Good morning, friends and family. It's good to be back home. I want to first off, I want to thank all of my friends and family who helped me during the time of this event that took place last week. I just want to thank y'all so much, and I want to express my empathy also for the folks who in the past had had circumstances take place with vertigo, different forms of vertigo. There's a few forms of vertigo that take place in an aging adult. But I personally experienced something that I never even saw coming. It was all of you guys know I'm a baby boomer, but what I cannot fathom the kind of experience I had here recently. I hadn't been admitted in a hospital in nearly 15 years, and I was totally not expecting any of what took place the way it did. Now, So I'd like to share that with you today because it does kind of explain what took place, even with someone who has been taking care of themselves and eating right and exercising right and doing all that we can do as we age. But for heaven's sakes, that's one thing that we'll talk about and how that took place. But another thing is that the whole medical facility has changed, in my opinion. I was in the medical industry for a little while, and I'll tell you what, it's changed a lot in 15 years. And I never thought I'd be a patient, that's for sure. But I was. So here we go. I don't know if y'all remember the merry-go-rounds that we used to get on in the playgrounds, where you push it and you spin. Anyway, to briefly refresh memory, I'll put a photo in at that point. But that is what took place, and that's how it started. It started that I wasn't feeling very well, and I was like, I was outside too long, or maybe I'm going through a bit of dehydration because we were trying to clean up the yard and stuff, and I just really didn't foresee what took place at all. But let me share this picture with you right fast. So if you had an opportunity to look at the photo that I sent about the merry-go-round that we used to, have in the playground areas years ago, and you would push it, and you would go round and round, and the faster you went, the better, the more fun it was. And it's no longer fun anymore, especially when you're on a merry-go-round that you can't stop. You're not pushing it to get that feeling. You're just on it. And you can't seem to stop it. You can't stop it, and it just seems like it's going faster and faster. And I want to empathize too for some of my clients who came to me in the past about, having Meniere's disease, or the type of vertigos that are just increasingly so uncontrollable. I mean, it's like you don't have any control. I don't have the Meniere's, but I do have the BPPV, and this benign paradoxical one is just unbelievable as well. As I can only imagine that if I had the more concernable vertigo, that just how horrible it must have been not to be in control of the way you're walking, or the way you can get to the restroom or the kitchen or anything. I mean, you're just you're a sober person in a very intoxicated environment, and you can't even function. So what's the problem with that? The problem is that you're at a much higher risk of falling. And I've been told by many orthopedic surgeons that falling to me would be very detrimental, because I have inherited such weak bones and very porous bones. Now, although as a nutritionist I take very good care of myself, I can't afford to fall, period. And it's then a part of knowing what to eat and how much calcium you need, how much phosphorus you need, what foods are full of those good nutrients that help you build bone, because it's a constant thing. I had just created a video on osteoporosis, and I look back at this video right before this took place with me, with the fall, and I said to myself, wow, I was talking about osteoporosis in a video in reference to someone who had requested that, and here I am in the hospital with a diagnosis that specifically is specific to having osteoporosis. So this video is very important to those. To me, I want to send out my empathy to the ones that have this very serious type of vertigo, such as Meniere's. And the BPPV is also a form of vertigo, not as severe, but the symptoms are very much the same to a certain extent. Now, with the BPPV, you have the capabilities of doing exercises. It's what I call physical therapy, because you're actually using, your head to position your head and get those little tiny crystals back into place. But never would I have thought that those little tiny crystals in your inner ear could make you stay in the bathroom for a good 3 or 4 minutes, just commode hugging, knee walking episodes of nausea. That's just unbelievable. I'd never experienced that before, so it was quite something. The pressure, the positioning that I was in only made it worse. And it just got worse and worse, to the point where I just couldn't even stand anymore. So my daughter just had to call the ambulance, because she was afraid to move me, really. She was afraid to do anything. And I want to thank her and bless her little heart too for having to go through all that. But anyway, we were off into the ambulance at that point. As I entered the ambulance, of course, they started assessing me and started fluids, which was really necessary at that point, since I had nothing on my stomach. I couldn't keep anything on my stomach because the world is still going around and around. Was a a drive to Galveston, so it was a good little hour drive to Galveston in an ambulance, and I was just praying, Lord, what is going on? I hope you're here with me, because I'm going to need all the help I can get to figure this one out. And again, I'm not too sure. I think I was thinking, okay, I must either be extremely dehydrated, or which I don't know how I could have done that, although the temperatures in Texas have been quite warm, and I had just, mowed the lawn that a few days prior, so I wasn't really sure what was taking place, and neither were they. So it was like, okay, we're going to have to take you and see what's going on, get an assessment from a physician. So I was like, okay, yeah, sounds good. When I was in there, in the ambulance, they were like, what medications are you on? And I'm like, I don't do medications, but I do take a multi. It was kind of like, I felt like, they're looking at me like, what in the world? I don't blame them one bit, because when I got to the emergency room, I also was going, what in the world? Especially when I'm in the emergency room area, and I have the physician to come in, fantastic woman who came in and was looking over me, and she was trying to figure out, are you on any medications? Because we need to give you some medications. And I'm like, are you allergic to, and she was asking me, are you allergic to anything? And I told her the few things that I was allergic to from 15 years ago, because I hadn't been in a hospital setting that long. So it was kind of, wow, it was really interesting. They had little robot called Moxie that was coming through and going back and forth in the emergency room, delivering things to the nurses and staff. And I was like, where am I? I got off of a merry-go-round. I'm still on a merry-go-round, and the whole world is different. The whole world is different. And that's what it looked like to me when this was taking place. So they're like, you're not on any medications. I said, nope. So we really don't know what you're allergic to. I said, well, if you hit me with something and I get allergic to it, would you rather just do something else? That way I won't have a reaction to it. And I was trying to offer some advice for myself. But, once you get into a medical facility, you have a paper that tells you your rights and the hospital rights. And although you can, request that you don't do this or that, and they will follow as good as they can. But what happens when that, like, no, I don't want that pill, or no, I don't want this injection for this and this, you have something else, that's not that, where I don't have to worry about a reaction or an allergic reaction to. And when you're told that, they want you to do an MRI to make sure that you didn't have some sort of stroke or something like that, and that they do not have that kind of they don't have that kind of equipment where you are at that point. So you're shipped off and you go for an hour ride to a facility that is huge. First time I've ever been there in Galveston at that facility. I've never seen anything quite like that. But just the hallway as they were taking me to go get this MRI and be admitted for to rule out a stroke or an ischemic stroke or something in the brain, I was just, I couldn't believe how big this hospital was in Galveston. It was just, it was like it was huge. I guess everything's bigger in Texas, but that was the biggest hospital I've ever seen, and at least in 15 years. But yeah, so that was kind of interesting in itself. So I was puzzled at the fact that they gave me a second x-ray when I got there. The first x-ray and the first CT was done in the emergency room in Angleton, Texas. But Galveston chose to go ahead and hit me again with another chest x-ray and an MRI the moment I got there as quickly as possible. So I'd say within the, less than an hour or so, I was being, again, doing these tests and giving blood and giving the same thing that I was had already given to in the other location. I am not to question how UTMB does things, but I just felt like that was overdone. It's not my fault if so I asked them. I said, why am I getting another X-ray? I just had one a few hours ago, and they were, well, we need it in a different position. Well, I've been in the same position for nearly 12 hours at that point because I couldn't walk. So when they took the first x-ray, it was a chest x-ray, and then when they took the second x-ray, I was in the same position. So I was kind of not happy about that. I just don't understand why you want to, if the picture doesn't come out right for you the first time, you shouldn't be charged for a second one. But that's the way it is. So we had those things done, and we had a group of doctors come in. And the group of doctors that came in were from neurologist to a very large student staff or future PAs. And some were neurologists, some were into the field of ear, nose, and throat, ENTs. I didn't get to see an ENT until the following day. So I had to stay overnight after they did my MRI to rule out the stroke. And so I got my ENT the next day, which was a blessing. So the next day comes up, and my ENT comes in that they had sent me. And again, it was a very friendly physician. She was absolutely amazing. And I just wanted to send you this video as well to let you know thank you. This ENT was very thorough, and I was blessed to have someone to come in with that knowledge and look into the ears and use these these instruments to see which ear it is, what area of the brain it is, because they did initially just rule it out. The MRI looked beautiful, so it wasn't a stroke, and it wasn't anything like that. And when she came in the next day and was like, well, we ruled out that, so now it's my turn. I was just so ecstatic about that. The CAT scan looked good, the MRI looked good, and here she was with these very interesting equipment to find out exactly where I was. And my blood work was looking good, so they were just totally baffled at all this. But what she did find is that the crystals in my ear had dislodged out of the area that keeps your equilibrium the way it's supposed to. I didn't fall, but I was in a position where I was forcing upside down, and that inside the inner ear, there are also little tiny bones. So the combination of having weak bones and, of course, being a baby boomer, it's going to not be a good thing. It might as well have been, getting knocked in the head, because as we age and our bones get a bit more porous, what happens is we can cough and fracture ourselves. We can be coughing or just sneezing real hard, and something's going to go if we do not start taking care of our bones. And I tell you, that was a real reality check for me, because I had just sustained a knee fracture last year, and I was taking probably 7,000 IUs of vitamin D3 with calcium and good foods, and never did go back to the physician because they were talking surgery, and I just didn't have the means for surgery. So I just went about myself. But now it's very clear to me that even that level of vitamin D3 and K2 was enough for the fracture building and breaking down bone to mend and heal. But after that, I ran out, and I came back to Texas to visit my daughter, and here we go. Completely forgot to continue to intake that amount without realizing it. Wasn't really realizing that the amount that I was taking for the fracture had gone specifically in that region to get that fracture going. So I should have been taking a little bit more phosphorus, a little bit more minerals to not only supplement for the fracture, but for myself. I mean, so it's all of this calcium production and phosphorus combination of calcium and all of these things that it's working to fix this. Thank you, Jesus, for that. But I wasn't taking enough for the rest of me. So it's really, really important that we, for those that really do not want to have to go to the doctor every year or every month or every 3 months, to check what you need. Examinations and blood work are fantastic to find out what you need. And, instead of guesstimating what your body may be utilizing, we're all different. But as far as nutrients are concerned, we need to know how much we need. We don't want to do over. We don't want to do too little. There are minerals and nutrients out there that you can do too much of that would not be good. And then there are nutrients and minerals out there that you need to know how much you need for your specific body needs. If you have porous bone, or you might not, or you might just be lower on A than you are on D or C or what have you. Micronutrient tests are great for that. All you have to do is do that once a year. And now that I'm getting older, I'm going to do it more than once a year so that I don't get to the part where I was recently. And that's, don't forget about taking care of yourself. That's for sure, folks. I'm telling you, all my baby boomer friends, let me tell you guys, we got to take care of ourselves, because everything is accelerated and everything is changing as we get older. And we don't have to fuss about it. I'm not fussing about it. But we have to be aware, just like many other things in our lives. We just need to be more aware of what's going into our bodies and how much we need to go in, and because everything else is contained by faith. And if you can take care of your temple, you can take care of a lot of things. So this video goes out to all of my friends and family today. I just wanted to let you know what happened, and that I'm recovering well, and that I'm going to also send you the diagnosis of what took place and how osteoporosis plays a huge part on that. And just say FYI. So if you have other folks in your family or friends that you know that tend to have a lot of fractures and everything, then it might be time for a bone density check or a micronutrient test, just to see where you are. And then after that, it's all good. All good. It all comes out for the good. That's all I have for today. But I should be back on par in just a few more days, Lord willing. So if you have any questions or comments and you need to give me a call, please do so. Have a great day. God bless.